Okay, good morning. Welcome to the Louisiana Department of Education 2020 Teacher Leader Summit virtual series. My name's Sharon, and I'll be your moderator for your session today. If you have questions or comments, please post them in the chat box. You are attending session A101 using the School Health Index to assess and inform school change session. And we're going to keep everybody's mic muted, and we're going to keep video stopped for participants to help with the Zoom platform working efficiently. And I'm going to turn everything over to your presenter.
Great. Thank you, Sharon. Appreciate it. Welcome, everybody. Good afternoon. Thank you for taking the time to be in virtual training as we all are trying to learn these new aspects of education and being educators and try to learn and as we grow. This is using the School Health Index to assess and inform school change. Welcome. Obviously, my name is Stephen Gaccioni. I work with the Department of Education in the section called the Healthy Community section. And I oversee PE and health, but also I am responsible for a grant, which I'll get into here in a little bit. Just some housekeeping things. As Sharon said, if any moment you have questions, you need me to slow down, need me to go back to a previous slide, feel free to do so. We're all trying to grow together. I welcome ideas. Like I said, it's important also, just know through virtual, sometimes things happen and we know we'll get through them. I do have a dog, so if you do hear a bark, it's almost better to leave him in. He's a beagle, but he don't say much. He's an old good dog, so just know that there might be a couple distractions, but we'll get through it together. Real quick, some of the objectives for today that we are planning to get is, enable schools to identify strengths and weaknesses. Obviously, by doing this in person, it gets a little bit, you get more out of it, but I'm going to do my best to show you the platforms and strategies of how we go about identifying your strengths and weaknesses based on data and assessment, which the School Health Index does provide. I will show you that it does create an action plan to help you in all aspects of schools, community, and obviously the goal of engaging, teachers, parents, students, community members, and everyone that is needed to help out with creating school change, but obviously student growth. So a little bit about, like I said, the Louisiana Healthy Schools. I'm the project director of a CDC federally funded grant. We award this grant 2 years ago. We're coming up to start year 3. But what it is, it's a collaboration between us and the Department of Education and Well Ahead Louisiana within the Department of Health. Our goal is to aim at increasing or improving student health and academic achievement through these aspects of nutrition, physical activity, management of students' chronic condition. We focus our work in 6 priority districts. Obviously, this is a statewide effort. We're trying to do this statewide. That's why being here at the Teacher Leader Summit is something we're really proud of, and we think it's just great because we're able to show that by doing these platforms and doing this work, you do see change, and part of that is this assessment. But with the federal funded grant, we tried to strengthen statewide infrastructures. That's through health councils, district advisory councils, and also school advisory councils. We deliver statewide professional development. There's funding, we help out with technical assistance, and you'll see that at the end of the slides that if you want more information or need more guidance on how to do this and multiple aspects of this grant, we can help you. We also have, in connection with this CDC, we do have some NGOs, non-governmental organizations that help us support our work that we're doing. That's through, the Alliance, which we work closely with, the Alliance for Healthier Generation. Donna did a webinar as well, or a virtual training as well. We do work with, the nurses, state organizations, Shape America for physical activity. We also work closely with, child nutrition to provide proper nutrition updates and strategies to do that. We also do collect data. Obviously, we all know as educators, what's the growth? What are the numbers showing us? We do have an evaluator. It's in the Department of Health side. And also, if you wondered, how do we pick these 6 districts? It was based on a very intensive and thought out strategy when we're working that the evaluator did. So we just then throw a dart and say, let's just focus our efforts on 6 districts. But there is evidence. Obviously, we try to use surveying, state surveying called YRBS, and youth risk behavior surveys, which some of you might be familiar with, and youth YTS. And then also health profiles that help us. By doing this work, we're able to see change. So real quick, we're just going to get kind of used to this whole virtual stuff. I want you to really be comfortable chatting in the box. I really want you to be comfortable also speaking. We all want to be in a safe environment where we can learn from each other. So just know that please just whenever you can, speak up if you'd like. And then most of the stuff's mostly just you chatting in the box. So my first one is respond in the chat box if you're familiar, or if you've seen, you can respond yes or no in the chat box if you've seen the WISC model before, and that's this model on the right. So I'll give you a few minutes to respond. Good. So actually, it looked like we had a good number of individuals that are familiar with the whole school, whole community, whole child model. But I will try to dig deeper in. We did have a person that works within our team do a webinar, or I don't know, I keep saying webinar, but a virtual training on this type of model. So I'm going to try to break it down to you quickly. And so the WISC, whole school, whole community, whole child model, as I said, pronounced as WISC, there are 10 components that we focus on, and that's in the blue area. If you're looking at the screen, you have, and I'll try to break them down as we get going, but they're building blocks to provide, collaboration among school, health sectors, community sectors. And the most importantly is that the student is in the center. We were focusing on then the green part: health, safe, engaged, supported, and challenged. These 5 tenets are extremely important if you're looking at student growth and academic achievement. Making a student feel safe, not just making sure they come to school feel safe, but also just in a classroom where they can explore and feel safe about it's okay to have failure, but also feel safe to speak out. And then healthy, not just obviously physical healthy, but emotional, mental healthy. We want to challenge them like we all do as educators. We want to challenge, we want to support them, we want to feel them engaged. Then if you look in the blue area, you'll notice that there are 10 modules, as we call them, and they do cover a lot of the components around the school health index that I'll get into. And some of that is employee wellness, and you will see that having employees happy and healthy and provided services, it does trickle down to the schools or to the students, which you'll see. And then obviously the yellow part is community. Extremely important to get community members and everybody involved, and that is able to support and gather resources within all these components. And how we go about it, and you'll see in the school health index, is that we form teams by assessing each of these modules. We're able to see where we can, gather resources or look for resources. And obviously in the wide area, that's looking at your policies that are already set in place. If your wellness policies, what is happening within the district level that you can actually, look towards to provide support for what you want to try to do. So in a nutshell, that's pretty much what the WISC model is. So in the chat box, since I just went over it, what does the acronym WISC stand for? If you want to try to, if you're not sure, you could even put, yeah, I know what it understands. You could give it a thumbs up, or. I'm trying to look at the, here we go. Gretchen, good job. All right. And as this slide, and you're going to see a few more slides like this, is just checking, checking for understanding, a little clarity behind what I just talked about, so you could instantly, what you learned, apply it. So the WISC stands for, see if I can get that, whole school, whole community, whole child model. So who are the important collaborators involved in the WISC? So who's helping us with this? If you want to put some in the chat, that'd be awesome. Good, good, good. Everyone, schools, all stakeholders, the community, good. Good, awesome. So yeah, so we want to look at schools and community and health sectors. We're looking community people, all stakeholders, who can help out with this to drive the work, but the resources into the WISC. So, and obviously who's in the center. If you want to put it in the chat, that'd be great. Children's in the center. Good. Thank you for participating. All right, now we're going to get a little bit in the school health index. You're going to see at the end, I'm going to show you the platform online, so you're kind of familiar with it and how you can go about doing that. So the purpose of the school health index is to use some type of assessment. And once again, it's not a survey. You're assessing where your school can look at its strengths and weaknesses, so you can create a plan, an action plan, a school health improvement plan, but also utilizing teams. And when I say teams, we talk about creating these teams. And honestly, I've been telling everybody that I work with that, let's use some teams that's already existing or in place. When I was teaching, we used an existing team. We didn't create a new team. As we know, as all teachers, our time is very delicate and time consuming. So we want to make sure we're using, maybe just some existing teams that you can drive some of this work. So the school health index, as you can see, consisted of the modules that we talked about in the areas of in the blue. We assess all those areas in blue, but there is 11 modules that we question, and the only difference is module 1, and you'll see that when I show you when we do our school health index, and that's around your health and safety policies and environment. Some of that might be at the district level, but each of these 11 components we'll try to assess, so you're able to see where we can gather resources and create a scorecard, and I'll show you that later on as well. So these are the 5 health topics. Yes, so we have 11 modules, but you could break it down into, if you just wanted to focus efforts on 5 health topics, and they're around, your chronic conditions, nutrition, physical activity, safety, your sexual health, tobacco prevention, alcohol prevention, stuff like that. We tell our 6 priority districts we really like for them to complete all 11 modules and all health topics. I just feel it shows, it gives you a little bit better assessment of where your needs are and where your strengths and weaknesses are. But if it's a lot to tackle with, so when you get in and do this, you could do a topic specific based on these 5, or not 5, the 7 topic areas. So the question coding you're going to see there's CC, PA, and TS. Those are all the topics that you'll see. The one difference one is the cross-cutting one. The cross-cutting coding goes along all modules, and you'll see that as you get into and do the school health index. You'll see the CC, the PA, and just know that's just the coding for those. So you probably, wondering, by results of implementing the school health index, or you're going to see we're able to create some school health teams. Some of the things we've seen, moved healthier options in front of the lunch line, creating those healthy choices for students, making the nutrition or the cafeteria more inviting, more friendly. So it's a healthier place to go. It just looks better. And also increased time for PE. We try to focus to get those allotted minutes based upon our guidelines and state legislation to drive the PE minutes. But it's also important, we try to get that. There's been students that do it, start a student and staff walking clubs. This is great, one, just for your out of school time purposes. And also, healthy choices, vending machines, and, offer some access gym outside. That's good for employee wellness, but also for students. So based upon what I just said, we're going to do another activity. What is the school health index used for? Oh, and I just told you, self-assessment and planning. I hit it too soon. How many modules are there? So in the chat box, if you want to put how many modules there are, that'd be great. Good. There's 11 modules. And who should use the school health index? School health teams, site coordinators, anybody that you want to see that could benefit from using this. It could be some of your advisory teams. How you will see is per your health teams or your school health advisory councils. A lot of them will break up these modules into each section of representation. So it's a little bit more time consuming and less taxing on individuals. So now we're going to get into the process of how to go about doing this. I'm going to try to break these down. We're going to break them down into, form a team, hold a meeting, you complete the modules, you look at the results, and then you reevaluate. So the first one's form a team. Like I said earlier, you could create a team, but how it works around those 10 components, those modules, you have a PE person that does it. You have somebody in nutrition that helps you out. And you have somebody, a nurse that's on the team. You have a parent that's on the team. You have a student that's on the team. All these individuals are important to have representation in your school health teams, not only to discuss of how to prioritize resources or how we can, increase the achievement scores, but also to look at and breaking up the school health index so everybody has some say and buy-in when they're doing it. So the next thing is, hold a meeting. Once again, I really recommend individuals within our 6-party districts, each at the district level, and it's legislation driven that, there should be some type of district advisory council. And that advisory council meets quarterly. This is what we try to follow at the state level, but also, we for the 6-party districts, we try to get them to hold their meetings quarterly, and making sure. But at the school level, I would just use existing meetings that are already set in place, teams and committees. And in these meetings, the process, you can explain the school health index, and once again, if this seems a little rushed and you're not really sure, that's why me and my team are here to help support your efforts, if this is something that you want to try to do. And once again, not just around doing the assessment, the school health index, but forming teams and all that. Like I said, identify who's going to be on your team, who can help out with each of those modules. I taught PE for 10 years, and honestly, what I did when I did the school health index at my school, all these individuals, I knew, their time was important, and I would just try to meet with them. I was the lead person when I did this. So I would go to each individual based on those modules, and I would see what I would walk them through and help them fill it out while I was doing it. It saved me time, and it got me quicker results. You could assign the modules, obviously, based on those. Well, you could use the example I just shared too. And then obviously provide directions for completing the modules and planning questions. And you're going to see that when we get into the online version. After we complete the modules, you want the results. We want to look at the data. We want to see where our school could use more support, how we can, look at maybe a couple weaknesses, look at a strength, but look at, 2 weaknesses, one weakness, and create an improvement plan. That's why it's really important that we start small. Obviously, we don't want to try to have, 50 goals or weaknesses. I was at a Title I school. We were very high in free reduced lunches. We needed there was a lot of help. I mean, we needed some results, and so we created just around, when we did it, we focused on nutrition aspect and also employee wellness. And by doing so, looking at the results, we did see a trend when you did focus on those 2 things in employee wellness. Staff started, doing more with the students outside. We created out of school programs for them. Now the students were more engaged, and what happens is a trickle effect that the students tell the parents come in. So you see, by just focusing on one module and maybe prioritize one weakness, you'll see results. So after that, you want to make sure you reevaluate, just like anything. We try within our schools with the 6-party districts, we try to get them to reevaluate every year. Every 2 years is pretty standard from CDC's expectations. So this is just to break down what I just went over: review the modules, assemble a team, identify a leader, somebody to lead. I was that person in my school. Hold meetings, don't create new meetings. You could make it part of an existing meeting to talk about all this. Complete the assessment, look at the scorecard. What's the scorecard tell us, and how we can prioritize our resources and work. And then, review. So I'm just going to go over a few keys to success. Build a school health champion, strong leadership. You want somebody that is passionate. We're all passionate. We're in teaching for a reason. We care about students. We care about the staff. We care about the environment. We care about our surroundings to help out. But most importantly, administrative buy-in. crucial. You know, the administrator being on a team, our assistant principal was, but it was important that I constantly communicated with the principal, just to inform them. They have a lot going on. We get it. And just to make sure somebody has that buy-in, you'll be able to just get a lot more done and be able to make some drastic moves in your school. Try to go around, get team representation, commitment. We have some guidelines to help you with this. I'm going to show you at the end of how to go about creating district advisory councils if you don't have one, but also school level. Clear, organized, well-facilitated process. Once again, we're here to help you out with that, but we can help you through those processes. Starting with small, achievable goals, like I said, start small, and then highlight, build on successes. I mean, we all want to, what are we doing? Let's celebrate as best we can and see the work that we're doing is impactful, and students are getting the benefit, plus staff, and parents, everybody. Let's celebrate. So now is the school health index format. I'm just going to pause quickly, and if there's any questions, I'm just going to give a few seconds to if there was any questions anybody has at this point. And I apologize, my screen is not cooperating with me, so anytime there's a chat, it takes me a few
Stephen,
steps. Yeah.
We did have a question earlier. What are the 6 districts who participate in WSCC?
Awesome. Yeah. And Sharon, please, anytime, just stop me if questions come up like that. Because, so the 6 districts we focus on is Tangi, EBR, East Baton Rouge, Monroe City, Lafayette, St. Landry, and Calcasieu. We reached out to 10. When we got the grant in 2018, we had to get commitments from superintendents, and these are the 6 that wanted to do it. And we've seen some great things. We've seen some drastic changes. For the most part, we established point of contacts within those 6 to help us, but we give them the resources, we equip them, and so they can trickle into the schools. And like I said, we had a process of how we picked them. That might be its own virtual training itself of evaluation. But if you want more information how we picked them, please reach out to me, and I can share that. Is there any other questions?
Yeah, we have one. Do you have any idea of how these initiatives will look with the CDC guidelines for possibly returning to school?
That's a great question, and that's something that we're always constantly, in this time of age, is the unknown and the unsure. Obviously this will be a little different if it gets to a point where we see less students in the schools and staff due to what's happening. But I'm going about it as I'm going to give you the information to say things are going to be good. We're going to be back in that phase where students are in there. But how this format will work, if we're back to the same way is the unknown. But you could still do it just to see how we can more resources and use your teams virtually. That's why it's important to connect with your teams, and we're here to help with that. How you can use your district team, or you want to create a team to, maybe during this time, how can we better look for some resources? Let's look at a few of the modules to get some data of where our needs are in each school. Then we can share it with the superintendent, principals, to prioritize, where we could resource stuff. Any other questions?
I don't see any more right now.
Okay, good. Great questions. Good. So now let's get into the format. Oh. So like I said earlier, there's a self-assessment process. We're going to discuss existing policies that are happening, practices, identify strengths and weaknesses. And also there is a planning for improvement process, like I talked about, looking at, prioritizing maybe a weakness that we saw based upon the school health index and how we can gather resources, use, community members, outside resources to help drive that weakness to see gains. What is it and what it is not? It's not for research or evaluation. It's not to like get you like, haha, gotcha kind of thing at your school level. It's in like the previous slide, it's just to assess we have so much resources and stuff. People want to help schools. People want to help students. It's just better to prioritize where your needs are. And using your team to talk about how we can use all this assessment and to drive everything instead of just grabbing stuff out of the air. We're able to, get everything and funnel it into the proper area. It's low cost. No, I mean, it definitely identifies, so a lot of these resources could be free. They're reasonable, user-friendly experience. You're going to see that CDC does have the online version, which I'm going to walk you through. There is paper version. I would recommend doing the online version, but if you're a paper person and you want to do it that way, you have the options to do it. There are two, you have one for the elementary level and one for the secondary level. So there's two different assessments. If you're a K8, I would just do the elementary one. A lot of stuff on here on this slide, but why use the school health index? Reduce absenteeism, physical fitness, reduces aggression and violence. It increases academic achievement. It also increases, participation, buy-in from the schools. And there's a lot of research behind using this tool around the whole school, whole community, whole child model, using the WIST as a platform to do this work. Just some clarifying points. Low scores on the sheet do not indicate low performing at all. That's not the case. It's just once again, look at, how to prioritize your resources. And it's okay to be in low performing in those, or not low performing, but if it's a low score, it just means that you can have resource to help out. Many actions will not require new resources. Like I said, we're able to provide information to help, school board. It's just community members. Here's the data, here's the assessment. This is what it says. It drives, not just conversation, but now you have some results behind it. And we all know, data drives discussion. This is based on our school. This is what it says. So real quick, I'm going to pause. I'm going to give time to kind of have everybody reflect. If you want to either put it in the chat box, if you want to come off mute, Sharon will help you with that. But why is this tool important? Let's start there. Why do you feel this tool is important? You can put it in the chat or you can come off and we can have a conversation about it.
If someone wants to make a comment and they raise their hand, I can unmute their mic. We do have a question. Where can we find SHI?
Good. So after this slide, I'm going to walk you through how to get there. I'll try to copy and paste the link to the chat box for everybody prior. Good. So increase academic achievement. Is there anything else?
I can see it benefits the students and teachers and drives morale at school up for students.
Good.
Can you see them coming? Can you see
Yeah.
those coming? Okay.
Yeah, my chat box finally is up and running. Yeah, I can see now. Good. Emily, healthier schools to help students learn better. Tracy, thank you. Ryan, thank you. Addresses factors that can affect academic achieves. Good. To increase needs of students. Reduces, yep, absence, aggression. Good. Yeah. So, I mean, it does help out with, just for me, it was able to just prioritize how, where our needs are, where some strengths are, where's our weakness. Like I mentioned before, um, you know, the school I taught in, there's a lot of needs, and we're able to, just by focusing on a couple things that based on the school health index, we were able to see not one area of employees, but now we just saw students, and then like I said, trickle effect. And for also, it's a great way to say, here it is, here's what it says, let's have a conversation about it. We want to do what's best for students always. Anytime you walk through those doors, we want, to get students to be around those 5 tenets. They're feeling safe, engaged, supported, challenged. We just want that, and how these tools can help out. Next question, how can it help your schools, districts? And I kind of talked about that a little bit. How can this help your school or district by doing this? Identify issues, good. Angela, may know or exist, good. It gives us some data based, good. It gives us some data, which is extremely important to identify necessary changes. And real quick, how we used it is we let our 6 districts, all the schools that did it, we created a kind of like a district scorecard, which I'm going to show you how you get all that stuff. But then we were able to prioritize professional development based on the needs of that. And also how a lot of them used it. Calcasieu, for instance, prior to this pandemic that was going on, they used it. They were going to do some really back to school employee wellness stuff, parent engagement stuff. They're going to do a lot of cool stuff based on the school health index, and they had a great conversation. I walked each of their schools that they targeted in that year, last year, of how to do this. And there was just some great dialogue. It led into some great conversations. And it showed just how passionate teachers are for students and their community within their school and outside their school. So what are possibly some next steps? So after all this, once we go through the index, what are some next steps? And I talked about them briefly in the earlier slides of what you can do. Create a team. Very good. Anything else? Good. Aha, great, Shelley. Introduce the tool to leadership. I like it. Get their buy-in. Add it to existing meetings. Team meet, good. Reevaluate, take actions. Good. Good. Identify resources that you're able to prioritize, and there's tons out there. Complete the modules. Good. Well, thank you everybody for sharing those. All right. Now we're going to get into time to practice, and I'm going to walk us through this the best I can virtually. So I'm gonna stop sharing, and I'm gonna show you the CDC Healthy Schools. But first, I'm gonna see if I could put it in the chat box for everybody. So those of you that are computer savvy or you want to try to multitask, I'm just going to navigate. So let's see if I can, I'm going to send this link to everybody, hopefully. And you could either navigate later, you can navigate now. Now I'm going to share the screen that I just linked. And I hope everybody can see that. Can everybody, I'm assuming you can see that, Sharon?
Yes, I can see it.
Wonderful.
And I tested the link, it's live, it works.
Good. All right, so, we already know about COVID. So let's do this. So this is your CDC Healthy Schools. Like I said, that we were awarded this federal grant. We work very closely with CDC, and they have all kinds of resources, obviously, when it comes to helping school. You can see there's guidance for schools, workplace. I mean, but that's not for this this session. This is more about, I'm going to let you kind of navigate this on your own, but there's stuff on social emotional climate. There's a PCAT tool, and you're going to see these tools also within each of the modules, like other analyst or assessment tools. But what's great is this gives you all kinds of different ways to go about, if you want to look at, professional development. But we're going to go with the School Health Index, and it's actually, they have a virtual health school, but we're going to click on School Health Index. So you're going to see here within the School Health Index, it's an online self-assessment tool. What's really neat after this, if you just wanted to share the link, but there's a guide here, and in person I provide these guides to everybody, but it's here, and this gives you an idea of how to go about what I just talked about, and you can give this to anybody. You can use it as your guide, but it breaks down everything that you need, from using the guide, facilitating groups, sample scorecards, which I'll show you. So that's a great resource to have. And what's really neat also is that you do have an e-learning course, which gives you it's a webinar that breaks it down for you. And you can go there by just clicking on the courses. So even after this, but at any time that you want a little bit more information, please reach out to, I'm willing to help out each district and each school. But that gives you a step-by-step process as well. So now we're going to get into, I'm going to show you the School Health Index, why you're here and how it kind of works. So you're going to click on this one. If you wanted to reach out to somebody in your district or school to see if there's been teams, I would start there, because they could share their reference number with you. There is a process to get to register. Just be patient with the platform the CDC provided. You can request to join an existing team if you know it, but if you register a new team, you could go here. Obviously, we go to Louisiana, and this is to register your team if you do not have one. And then you got to look up your district ID, and you click this. Like I said, there is a process. It's kind of hidden, but if you look up here, these tool boxes up here make it a lot easier for you to locate your school and the numbers that you need, this NCES number. So just know that just be patient with the system. But they actually did make it a little bit more user-friendly. So no, that's where you would go to register your team. For time purposes, I went ahead and registered my own team. And I'm going to walk us through one of the modules. So from here, we got an LA school. And as you can see, it breaks it down. Step 1, modules and questions. Step 2, overall scorecard. Step 3, improvement plan. So what our first thing we wanted to do, and also, you know, over here on the right side is you got all of our modules minus the one around safety and all that. But we're going to click on modules because we're ready to complete this. I had a team that completed some of them. Here are the health topics. The green arrow indicates which modules were completed. We completed module 1, module 3, and that is it. I'm going to go through quickly module 4 for everybody, just quickly. We're just, hypothetically, we're going to say this, you know, we'll just make, just for purposes, just a random school. But just remember, these health topics at the beginning, you can pick what you want to focus your school on, and it will break out your questions according to that. So nutrition, physical activity, you know, you got the alcohol and other drug use, safety, tobacco use. So let's look at health education. Like I said, we already did module 1. So you click on discussion questions, and it takes you through the process. There's 16 questions here. We'll put yes. And it breaks it down for you. So each question you can see, you know, when it does talk about this, then it gives you some, it gives you some outcomes of, you know, how to use it or what's happening. You know, are we using a curriculum? And this just gives you an idea of what the questions look like. And then I'm going to show you how we're going to use it. And you're going to see how easy it is just to export your scorecard and everything that you need. And I'm going to show you that here after we're done. So the PE teacher could possibly do the PE one, the physical activity PE one, and also this one. So just know when you're doing this inside your school, like I mentioned earlier, I went around to the cafeteria staff, the food service staff to do the nutrition one. I met with the nutrition director to help with that. I walked to the counselor to help. So just know that if you do have a leader and that person could be you. All right, we just completed it. Now you're going to see these numbers. This 3 obviously is fully set in place, partially in place for 2, not in place is 0s. So based upon that, after we have completed that, you go to the strengths. You know, we add one of our strengths, and in your committee, you're going to say, well, we have, you know, we can use the health education is taught in all grade levels. That'd be your strength. And you would add here. And this will all generate and save for you. So we'll add a weakness, and based on your team, you start discussing, we just don't have a curriculum. So a weakness would be, you know, our curriculum is not set in place. So we'll just add that. Not sure if I spelled that right. So now just in step 2, so it takes you in step, we add an action. Based upon that, our action 1, you know, breaks it down. Is this very important? Is it inexpensive? So our curriculum, is it very important? Yes. Cost. It all depends, you know. Maybe there's already a curriculum out there that is free, and there's a lot of stuff that's out there that's free. So let's put somewhat time. Not necessarily. If the PE teacher's doing it, I mean, it might be some consuming, somewhat minimal time. Commitment, very enthusiastic. Is it feasible? I would say it's somewhat easy. So then we just got all that. We hit save. Oh, recommendation. We'll just look at existing curriculums. And we'll save that. And then put continue. So now we just did that. So now you're going to see that we have this. We just did that. Now let's go back to our modules and questions. Now let's look at our scorecard, because and then I'm going to show you how. So now we did modules 1, 2, 3, and that's it. And obviously you're just going to see the scorecard. And when you go to the overall scorecard, it's going to show you where we're at. And you can export that and send it or print it. And let's see if it does it. So you have this, and I would have to show it to you on a different screen, but you can export this here and send it in an email. So after that, you have your plan for improvement. Obviously, based upon that, we have our plan for improvement. So when I was looking at the PE one, it was, you know, our out of school time. So we are going to contact the rec director, by whom, obviously we want to see who it's done by, and the date we want to complete it. And this all does this for you. And you can print this out as well by going to export plan for improvement. So as you can see, this is based upon, each person would recommend a weakness based on that module, but you would have to prioritize in your meetings where you want to focus your work at. And honestly, for my school, this one, as we're working on this, is let's work on our out of school time. Let's contact the rec director. The PE teacher is going to do that. And then we're able to resource that specific weakness. Is there any questions? I know that's kind of fast. Like I said, when I do this with our priority districts, it's a step-by-step process. It's a quick process, but you would have to navigate. So any questions? Let's see if I can pull up the chat. You could either ask to come off mute.
I can see one. Would you
okay.
Would you just search on Google, for example, curriculum?
Absolutely correct. Yeah. You would just look at, you know, there's stuff that for any type of curriculum around PE or even health. Obviously in the department we don't promote anything but open. The U.S. Open or open curriculum is a good choice. But yeah, you would just look for those curriculums if they're free to you, or you know, or you know, there might be some might cost, for instance, for you know, Shape or Spark it costs money, but there are resources around curriculums that you can search. So I will provide go ahead.
Yeah, we have a request for your email in case I have questions later.
Good, and actually, Kaylin, thank you for, my email will be on one of the later slides at the end. And Kaylin, which I work closely with Kaylin, she's a professor at UL, but she just put in the link to openphysed.org, and that has a kinds of resources for you around phys ed and health. And Shape America is another one. So, and also Kaylin represents our state organization. So thank you, Kaylin. So I'm going to go back to keep asking questions. I'm going to go back to the PowerPoint. So real quick, what I just talked about, this is the written version. So as you can see from module 1, this is planning question number 3. The actions they took, form a school health team, the importance, cost, time. What's good is the online version does this all for you, and you're able to print this specific slide out or export it and send. So this is your sample of that school health improvement plan. I typed it in, but this is gives you an idea of the action, the steps to get that action completed, and by whom and when. It's important that we address who's going to do this and when we're going to do this. Obviously, if they don't accomplish it by the time we put, it just gives everybody, we're all creatures of habit. We don't want to get something falling between the cracks and we forget about, specifically if we're very passionate about it. That's why it's important that we stay consistent with meetings. So we're on top of our actions and the steps that we need to do it. So this is an action and steps around nutrition. Establish a set of competitive food offerings that align with strong nutrition standards. Meet with the principal. That's a good start. That's pretty easy to get to. Develop a slideshow, maybe that's good. Visuals, that might be one too. New screens in the cafeteria. So. Yes, so I'm just following up on some questions. I can share the PowerPoint with you. I made some changes to the one I sent to you, Sharon. So I will do that. If you email me, that would be great. That'd be probably the easiest thing to do, and I can send that to you directly. So like I talked about, we work with the Alliance for Healthier Generation. Donna Crawford did a virtual training, like I mentioned, but this is what we let other people use. This is another just a planning guide or action planning chart. And this is all on their website, the Alliance, but it guides you, it tracks your progress like I talked about, and it reports to the public and it provides updates. You can update it as you go. So some of the resources I talked about, this is our advisory. You can find this online. This is how to establish your health advisory guidebook. That's online. And then the Alliance for Healthier Generation is another one. And obviously I just showed you the CDC School Health Index and also the platform to go about all kinds of resources. So we're here to help. Sharon did provide my email, but as you can see, we do have a number of people that help us to drive Louisiana Healthy Schools. I'll leave the slide up for a little bit so you can either write this down, take a picture of it. But if you email me right away, I will provide this PowerPoint to you. And just remember that at the end of this I'll have a QR card or a code that you can scan as well to get some assistance. Oh, sorry. Few more seconds for everybody. You're probably familiar with this slide, but this is for you to, once again, just thanking you. If you want to leave feedback, please leave feedback. I'm going to leave this up a little bit so you can navigate how to go about providing feedback. As we are in this, the new virtual trainings, we're all trying to get better at doing this. I'm such an animated person. If anybody's, and I saw Kaylin, but it's hard sitting down and doing this. I like being interacting, so we're all trying to get better, but please leave the feedback, rate it. And provide comments if you want. You know how it goes with feedback stuff. This is how you connect with us. If it's not working, I don't know if it would work or not. This gets you right to a platform to providing technical assistance, and that's around, once again, creating help teams. If you need resources for any type of aspect, we're here to help. With chronic conditions, nutrition, physical activity, PE, the whole school, whole community, whole child model. So those 10 modules, we're here to help you out. Any other questions? While you're thinking of questions, oh, I see some are popping up there, but let's see. Hey, I can't thank you enough. Obviously, as you're thinking of questions, you can come off mute if you want, just ask to come off mute. But being a former teacher, usually I get on a soapbox about how passionate I am, not in just all aspects of the school and how important it is for students, but also staff. And it's amazing each role and how crucial it is. My dad was maintenance for 30-some years in a school, and he made such an impact on students that they still see him to this day. And it just showed, to me, it just shows how important, it don't matter what role you play, transportation, principal, food service staff, counselors, teachers. I mean, my heart just goes out to everybody, specifically in this time. And what we got to try to do to better equip parents, students, all of you, including myself. And I just thank you day in, day out. And I'm here constantly fighting for teachers and administrators and transportation people and food service staff. And I'm just a huge advocate for everybody. And I can't thank you enough. And good luck. And hopefully this training has been great for everybody. It's been good to see the impact and the results from it. So with that said in mind, if you ever need something out of me or my division within the Department of Education, I'm here for you, and I got contacts that could help you in any aspect of the whole school, whole community, whole child model. So with that said, I'm going to leave it open. You can ask questions. If not, I'll let you be to your next session, and take care, be safe, and know you have me and my team in your corner at every time. So thank you so much.
Thank you, Stephen. If anybody has a question, if you press the yes button under manage participants, I can unmute your mic for you. I don't know if you guys can unmute yourselves or not, but I'll do it for you if you press the yes button. All right, I'm not seeing anybody press the yes button, so thank you very much.
Hey, thank you, and your team done amazing work. It's navigating through Zoom has been something. So thank you so much, and thank you everybody. Enjoy your day.
Thank you. Bye-bye.